It's been touted as a model for success in Durham. We're talking about the popular HEART program, which helps people in a mental health crisis get the help they need instead of relying on police.
Tom George live now here in downtown Raleigh, where there's now a new movement here to get the same kind of program off the ground in Wake County. Tom.
Yeah, Stephen, Lauren, we've heard about the same problems here in downtown Raleigh time and time again. People in mental health crisis not able to get the help they need, people feeling unsafe, not enough officers. A lot of people believe a lot of those problems are interconnected, and a lot of people also believe that what's been working in Durham could also work here in Raleigh. You've seen their vans out and about across the Bull City, their crews with their hard-to-miss HEART shirts. For the past year and a half, Durham's popular HEART program has worked alongside 911 centers to get social workers and crisis teams to respond to non-emergency mental health calls. 8,000 plus calls later, it's been touted as a success, earning them a major expansion.
This will work, and Durham is leading the way.
And it's gotten a lot of attention just down the road.
And I see it. I see people who are talking to themselves.
Doreen Martin is a mental health professional at Mindology Raleigh, and even off the clock living downtown, she sees the crisis firsthand.
I've even seen this lady around Moore Square with a, it was like cold. She was like, like just in her underwear. And so when I asked about help for her, they had already called the police.
But she says police aren't always trained to handle mental health cases, and there's no substitute for trained counselors and professionals.
It could be the way that they talk to them and reason, and it's totally not, and they don't feel the threat of the police.
She's among hundreds who have already signed on to give public feedback to the city of Raleigh, calling for a program similar to HEART to be created. On the city's website, many leaving comments in support. Among the top comments, calling for professionals who are compassionate, empathetic, calm, and trained to de-escalate situations, and versed in trauma-informed care. And Martin believes, just like in Durham, if Raleigh builds it, there's an army of experts with a heart ready to step in.
You probably have an overwhelming response because if you're in this field, you want to help people. And you're empathetic, but you also know that they need more than, they need someone to identify what's going on with them and recommend the appropriate treatment.
And right now, this is really in the early stages. That online feedback website is going to be open all the way through March 10th. In the meantime, they're also going to be soliciting feedback from the public at some in-person sessions. Those are going to be going on the next couple months. The next one happening this Saturday at the Southgate Food Lion from 1 to 4 p.m. Reporting live, Tom George, ABC 11 Eyewitness News.